Hey guys, I wanted to create a video to discuss what to expect on your day of surgery. So it actually begins the day before. So you will have received instructions either from your surgeon or from the facility where you are having your procedure done to or for things that you should be doing, a few days or at least the night before surgery. And the main thing is nothing to eat after a certain time. Usually we say nothing to eat after midnight, but again, you listen to whatever has been written on the paperwork that was given to you beforehand. The reason for that is because we don't want anything to be sitting on the stomach when we put you to sleep for surgery. Because if you do have something in your stomach, when the anesthesia provider goes to put you under anesthesia, the things that control keeping your food contents in your stomach relax, and so you're at risk of essentially vomiting those contents back up and inhaling those in your lungs, and that can lead to a slew of medical issues and concerns. It could land you in the hospital. A lot of bad things can happen if that were to happen, so that's why it's very important that you listen to our instructions when we tell you not to eat after a certain time. It's for your safety that we are having you do that, not because we want to torture you, okay? But so you want to make sure that whatever that time limit is, that you do not eat anything past that time per the instructions. Usually it's okay for you to take your medication. So if you have high blood pressure, things like that, then that would also be related in the instructions that you're okay with a small sip of water to take those types of medications. Again, just follow the instructions that were given to you on what medications are okay for you to take the morning of your surgery or the night before your surgery. And again, you just need enough water just to take those pills down. You do not want to have a full cup of water. So the other things that you may be advised to do before surgery is to clean your body with an antibacterial soap. You want to make sure that whatever areas that we're going to be working on is nice and clean. And everybody has different opinions on whether or not you should shave certain areas. For example, if you were to have a tummy tuck, should you shave your pubic region? Because we like to keep our incisions nice and low, and it does. We do place those incisions in the pubic region. So again, you just listen to your surgeon, because everybody has different preferences on whether or not we want you to do the shaving or whether or not we will shave you ourselves once you get to our facility or in the operating room. So, but in the meantime, you can just make sure that your body is nice and clean. If you have any body piercings, you want to make sure that you remove those and or switch them to plastic piercings. Again, everybody will have different preferences on whether or not they want them completely out or whether they're okay if you have plastic ones. But you want to just keep in mind that any piercings that you have are going to likely need to be removed. If you have any piercings that cannot come out, like dermal piercings, or if it's a piercing that you've had for 15 years and you've never taken it out and you tried and just can't get it out, you want to make sure that you relay that information to your surgeon so that they can make any necessary adjustments to make sure that essentially you don't get a burn from having that metal on you. So what you may not realize is during surgery, we use something called a cautery device. It's an energy device. It sends electricity to a little pencil that we use to essentially cut through the skin and to stop bleeding. So if you have metal in your body, there's always a chance that that energy could be transmitted to that metal and cause a burn. And so that's why we recommend that you remove any metal from your skin prior to surgery. So the other thing is, so those are the things to do essentially like the night before surgery. So when you come the day of surgery, things that you can expect is, if you haven't already, there'll be probably some additional paperwork that we'll have you sign and fill out, just going over your consents again, going over your post-op instructions. Those will be things that you will be discussed with if they haven't been done previously on your day of surgery. The other thing is, you will speak to your surgeon. They will do your markings. We usually take more photos, and then we just again have that discussion with you on what your expectations are, what your goals are, and then realistically the results that we can get for you, what you can expect from your procedure. We can go over any other questions that you may have at that time, and just make sure that you're comfortable moving forward with the procedure. You will also have an IV place. Now, again, depending on the type of procedure that you're having done, because there are procedures that you can do without general anesthesia. So what I'm referring to is if you're having general anesthesia done. there'll be a separate video to talk about the different types of anesthesia, but general anesthesia is when you're essentially fully asleep and there's a tube down your throat and the machine is breathing for you. So an IV will need to be started, and usually it's in your arm or your hand, and that is just an avenue for us to give you medications to get you comfortable, to start the medications to get you off to sleep. And so that will be done beforehand. You will speak with the anesthesia provider and they will talk to you about their parts of the procedure and answer any questions that you have about the anesthesia. And so then all of that will be done, you know, once you've had your markings done. And sometimes other things that may happen when you get there is also like a pregnancy test. Sometimes some surgeons will check and make sure that you don't have nicotine in your system as well, because obviously we don't want to do surgery on somebody that's pregnant. But not smoking before surgery is also very important, because if you do have nicotine in your system, your risk of complications shoot up. So you want to make sure, a lot of surgeons will not do any big procedures on somebody that has nicotine in their system. So we will usually test for that the day of surgery. So let's say you've checked all those boxes, everything has been set and ready. So then we will bring you to the operating room. So when you go to the operating room, you'll see essentially like a blue sterile setup that nobody touches. You'll lay on the OR bed, and the anesthesia provider will make sure that you're strapped in so that you're secure on the bed, and they will get you off to sleep either through medications through your IV, or they'll sometimes put a breathing mask over you and give you anesthesia through the mask as well, and we'll put you to sleep. So at that point, you're unaware, you're asleep. To you, you'll wake up and it will seem like no time has passed. But during the procedure, you'll be asleep. When you're asleep, we will what we call prep, or essentially clean the area that we're working on. So usually we use either betadine or something called chlorhexidine, depending on whether or not if you have an allergy or just surgeon preference, to clean whatever area that we're doing the surgery on. And then once things are nice and clean, then we drape you, or essentially put sterile towels or drapes around you to make sure that any part that we're not working on is not being exposed to the area that we are working on. And once things are draped, then the surgery gets underway. And after everything is done, we clean you off, we put on your dressings. Usually we may either put like a skin glue on your incisions, sometimes we put tape, sometimes we may be putting pads to catch any oozing, and whatever garments that you need based on whatever procedure you're getting done. So either a surgical bra or an abdominal binder or a faja, depending again on the procedure that you're having done. Then we move, well, first then the anesthesia provider will essentially remove the tube out of your throat as they start to wake you up, and we move you to the stretcher, and then you go to recovery. And so in recovery, that's when you'll start to wake up. You'll start to become more aware, and the nurses will be monitoring you, making sure that your blood pressure and everything is fine. We'll make sure that your pain is under control, make sure that you're able to get up and walk around, make sure that you're able to pee, to make sure that you are okay to go home. And so usually you're in recovery for about an hour or so after surgery for all of those things to happen. And then we put you in the care of your loved one and we send you home. And so that's kind of play by play of what happens your day of surgery. I hope that was informative. Again, if you have any questions, just leave them in the comment below.